Thank you for joining us as we complete week one of the Age Well Epic Conference with our special National Accessibility Week session, Improving Air Travel Accessibility for Older Adults and People Living with Dementia. My name is Alison Schneider, and I'm the Education and Training Manager at Age Well, Canada's Technology and Aging Network. Before we begin today's session, I'd like to note that the Epic Conference sessions are continuing to take place on Zoom from 12 to 1 p.m. Eastern Time from Monday to Thursday next week. We encourage you to attend all of the sessions, and you can check out the Age Well Epic Conference webpage to download the Epic Conference program, which includes details on each session, or to watch a recording of any of the sessions you've missed. In this special session for National Accessibility Week, we will explore the range of barriers to accessibility in air travel and how older adults, people with disabilities, and people living with dementia experience air travel. I'm excited to introduce today's Epic Conference presenters. We will have Tilak Dutta, who will discuss how his team at KITE Research Institute is working to identify and address the biggest challenges in air travel. And we also have Ali Shirelli, who will highlight air travel, of course, barriers, facilitators, as well as some of her interviews with people living with dementia and their travel companions to explore the emotional experiences during air travel. These two featured presentations will be about 20 minutes each. We will have a 15-minute Q&A session after both presentations are complete. All attendees are encouraged to use the Q&A box to ask questions, leave a comment on a question, and upvote any comments or questions that others have submitted. We also welcome you to use the chat. Please note that you can enable closed captioning in Zoom, and that's located on the Zoom toolbar. This session is being recorded and will be available for playback on the Epic Conference webpage, as well as AgeWell's YouTube channel. Okay, without further ado, I'd like to invite Tilak Dutta to be our first presenter. Tilak Dutta is a senior scientist at KITE Research Institute and holds appointments as an associate professor at the University of Toronto at both the Institute of Biomedical Engineering as well as the Rehabilitation Sciences Institute. He leads the engineering health team, which is made up of 15 engineers, clinicians, and social scientists who work together to give individuals with disabilities and their caregivers the tools they need to realize their full potential. His team's ongoing projects include preventing falls on ice with advanced winter footwear and training, improving pedestrian safety at intersections and on sidewalks using computer vision, preventing back pain for caregivers in the home using wearable devices like Posture Coach, and removing stubborn barriers to accessibility. We're excited to have you here, Tilak. I will turn it over to you.
Great. Thank you very much, Allison. Thanks for that great introduction. I'm really excited to be here today to talk about one of our projects that fits nicely into this National Accessibility Week event. So I thought it would be valuable, because we are in National Accessibility Week, to just think about the word accessibility just before we jump into the project, because I think one of the biggest barriers to accessibility actually is our lack of awareness collectively about what it could mean or what it should mean. It used to mean, I think, if you ask some people, I think most people would say it has something to do about getting people physically, like people that maybe are wheelchair users or have some kind of physical disability, into a physical space. But that definition has broadened, has been evolving, and has gotten much broader. And with the passing of the Accessible Canada Act in 2019, I think the core of it is that people with disabilities now, we think about full and equal participation for anyone that has a disability that includes physical disabilities, but also sensory, cognitive. And we're going to get into some of those today, I know, with Ali's presentation. Our team's been focused on wheelchair users or people with mobility devices in air travel and the challenges that they face. So we'll dig into that a little bit more. But broadly, accessibility, if we think about equal participation, that's what the law in Canada now requires or will require by 2040. that people with disabilities can be equal in participation in all the activities that they want to participate in. And it's sort of a working definition that our team has been coming together with. I think just being able to do something is not quite good enough. Getting into a physical space isn't quite good enough. We can think about three other factors. How safe is it? How much independence does someone have? And can they do that activity with dignity? I think those are the factors just to ground these ideas. Safety, you can think of if someone with a walker is crossing an intersection, but the time that they're moving at a speed that's too slow and they aren't allowed enough time to cross before the signal changes, I would argue that that intersection could be made more accessible. If you think about a conference that you're at in person and there's a raised stage, you can think of two ways of helping someone with a wheeled mobility device to get up onto that stage. They could have a ramp, which the person can independently go up and get up on the stage, or you could have some kind of lift device that you need someone with a key to come over and activate for you. Less independent, so you aren't able to get up on the stage independently. So it's one is more accessible than the other, I would argue. Similarly with dignity, the example I thought I've been thinking about a lot over the last few days, we've had research days with biomedical engineering and the Rehab Sciences Institute had their research days at U of T. And at the poster sessions, I always think about how awkward it is, how tightly packed they make the posters, the height that they mount the posters at, so that someone in a wheelchair, if they were to come to that poster session, they would find themselves awkwardly trying to make space for themselves to talk to a presenter or to look up and read a poster that's too high for them. So things like that are what we're trying to think about. Air travel, I think, is maybe the one of the best examples of an industry that has managed to insulate itself from this evolving nature of accessibility that's been growing. Frankly, in Canada, we're pretty far behind on most accessibility related things, I would say, compared to many countries in Europe or the US. Things are changing with the passing of the Accessible Canada Act thing and the creation of Accessibility Standards Canada. There's been a really fast acceleration of some of the research that's been happening in this area and changes to new standards and things that have been going on. But air travel remains a huge there are huge barriers for people with disabilities in air travel. Perhaps in my mind, the most egregious problem that has been happening for a while and it's finally getting attention is that wheelchair users get their devices damaged when they fly far too often. So this was a post that Maya Ziv made in 2022 when her power wheelchair was damaged to the point that it couldn't be used anymore. And it set off a lot of attention. It got a lot of attention. Politically, it got a lot of attention. The Canadian Transportation Agency came to us and said, can you help with funding from Accessibility Standards Canada? Can you help us figure out what the problem here is? And we gladly accepted that challenge. And our team we're about halfway, just over halfway into this project now, looking at this. Some of the members of our team are below. And the goal of our work is really to come up with recommendations for safely securing, loading, and unloading mobility devices when people are flying with them. And there's 6 activities that I'll briefly talk about that we're doing to undertake this work to come up with those recommendations. The first was we wanted to do an environmental scan and a scoping review to see what guidelines are already out there. Our hypothesis is that the that either the guidelines that are already out there, the question is, are they sufficient? Do they have the right level of detail? Or is it that or do we need to add something to those guidelines? Is there something missing from the guidelines? Or is it that people aren't following the guidelines? And spoiler, it's both. It's a little bit of both is what so far what we've been finding is the issue. The big part of the problem we think has to do with narrow body aircraft. That's the image you see on the left. The image on the right is what happens when you have a larger aircraft, a wide body aircraft, usually it's called, wheelchairs get put into containers that get lifted into the aircraft. Much lower risk of damage in the latter case, much higher risk of damage in the former case with a narrow body aircraft. So what you see on the left is this space where you can try to imagine taking a 350-pound wheelchair and maneuvering it in this kind of a crawl space. There's not much room in there, so you're bent over trying to position and tie down one of these wheelchairs in that space. And before you can do that, you have to get it through a door that's probably too small, that may be too small to fit the wheelchair in upright. So those are the kinds of challenges that we're dealing with. And the existing guidelines try to give guidelines on how to avoid damage. They say things like tipping or laying a mobility device on its side is to be avoided. We believe that a lot of the damage that happens is occurring because the device is being put on its side or on its back to get it through the door of the cargo spaces. Other damage is probably occurring because of the way we're tying these things down. The guidelines include guidance that says do not over tighten or avoid over tightening. But how does the person that's putting these straps on know when it's tight enough? Those are the kinds of questions we're trying to answer. Other research from the National Research Council has found that one of the issues is that using these belt loaders to get wheelchairs into the cargo space of the narrow body aircraft is one of the challenges because the wheelchairs are just that they're barely fit on the conveyor belts that are used on the belt loaders, and so it's a very high chance of if the wheelchair moves a little bit, there's a very high chance that it can actually fall off the side of these belt loaders. That happens, and there are catastrophic damage occurs whenever that does happen. Um, Other recommendations include using devices to lift these wheelchairs onto the belt loader when a belt loader has to be used rather than manually lifting. In many airports, if this type of equipment is not available, the staff will actually physically lift a 350-pound wheelchair up onto that belt loader, and it's not safe for the staff and it's not safe for the wheelchair either. So part of our work was to do a number of these airport visits where we watched the process that is used to move to get these wheelchairs on board aircraft using the best practices that different airlines are using. Um, what we know now is that there are a range of different levels of some airlines are following the guidelines very closely, and others have decided to create their own guidelines to make their staff perform things in a way that they believe is safer. Our team went and watched a few of these. We brought along our wheelchair that was donated by Motion, and we watched as the staff put these devices into the cargo areas and tied them down, and then we took 3D scan. We brought a 3D scanner along. We scanned the space so that we could bring the wheelchair and so that we could take this data back to our lab. So on the left, you see our simulation platform here at the KITE Research Institute, so that we could simulate doing strapping down wheelchairs in different ways inside of our simulator while the simulator was performing a simulation of different types of takeoff and landing and turbulence that are experienced using publicly available flight data from some of these aircraft. And so here you can see a video of some of that testing going on. We have load cells connected within the straps so that we can measure the tension that's being put on these straps while the simulation is going. One of the things that we noted with the way that most of these devices are strapped down is they use straps that are connected at the two ends to brackets in the floor. But as a result of that, they don't make use of the existing tie down points that most wheelchairs, most power wheelchairs will have these tie down points. They're designed for hooks to hook into. So if you're in a wheelchair van, you would have these ratcheting straps that these self-tightening straps that go into those tie down points to secure the wheelchair. They're not able to use those based on the type of straps that they're using now. Instead, they have to sort of wrap these straps around the wheels, around the parts of the base, which doesn't seem like it's the best approach to keep those things safe, keep the base safe, because they're actually plastic cladding that runs around each of those components, and there's a lot of pressure that gets put on there when the devices are strapped down in this way. The one thing that we noticed, this is a picture of one of the brackets that is used with those yellow straps that I showed in the last slide. It's called L-Track. The exciting thing that we noticed, so my son uses a wheelchair, and in our wheelchair van, I noticed that the type of brackets that are being used in the aircraft seem to look a lot like the brackets we use to tie down my son's wheelchair. And it turns out they're the same thing. And so it opens up the possibility of instead of using those yellow straps, we could use the same type of straps. They're called Q-Straint. They're made by a company called Q-Straint, that are these self-tightening straps that spool out and have a hook at one end. And so this is going to be one of our recommendations. We've had some discussions with some airlines about switching from the type of strapping they're using now to this type of self-tightening straps that have the hooks in them. Um, and we've actually found that one of the biggest benefits of using this kind of these straps is that the tension that you put on that the wheelchair is exposed to is far lower. We can reduce the load on the wheelchair when it's tied down if we use these self-tightening tie downs, because they self tighten to the right tension that's required, where the other yellow straps end up with much higher loads in some cases because the user has to decide how tight to make it. One other thing we're going to test is these new Air Canada has just purchased some of these trays. The idea is that the wheelchair can get strapped down to the tray, which then gets secured to the floor in the aircraft. It can reduce some of the challenges with tying these down safely. But we're going to find out if that's a good solution. The other thing we're doing is we're recruiting participants that use wheelchairs that are flying to put a small data logger on their wheelchairs for during their flights. So we want to see how often the devices are, for example, secured properly when they're being flown around. Are they moving around while they're in flight? And are they getting tipped when they're going through the cargo doors? When they're getting tied down, are they getting put on their sides? And so far, we've collected data from 21 participants, 21 flights, and this gives you an idea of the data that we're able to get from these data loggers. So you can see this is when the wheelchair is handed over and during loading. Here's the flight portion over here where there's takeoff and landing, and then where the unloading is happening. So you can see the biggest the biggest spikes that we see are during loading and unloading, and it underscores our hypothesis that most of this damage is probably occurring during loading and unloading. We have now seen some. So the graph I showed previously showed what flight looks like when the device is tied down nicely and it's nice and secure for the flight. Here's what it looks like when the wheelchair isn't tied down properly. What you can see is that after takeoff, some point during the flight between takeoff and landing over here, the wheelchair tips over. So it's unclear whether it was strapped down maybe partially and one of the straps somehow slipped off one side, allowing the wheelchair to flip over. But basically, we can see that the wheelchair tipped over pretty much 90 degrees at some point during the flight. And then when they landed, they turned it back over to right side up to put it back on its wheels while it was being unloaded. So far we've seen some instances of things like this happening, which indicates that there's definitely some need to improve training or the robustness of the tie down process. We've also done some surveys with passengers. This was done in partnership with Muscular Dystrophy Canada. We had almost 1,000 responses, and about half of them. So sorry, this survey was broadly asking about what barriers have you experienced during air travel? What accessibility barriers have you experienced during air travel? About 1,000 responses. About half of them were people that use wheelchairs or mobility scooters. And we dug into that data further, and we saw that about two-thirds of those people that used a wheelchair or a scooter, that flew with a wheelchair or a scooter, experienced damage to their devices. So that's very high, and I think we can all agree that there's something very wrong if two-thirds of people flying are experiencing damage to their devices. Notably, other people also experienced delays in having their devices returned to them, about 58% there. We've published some of that work in an initial paper on this project so far. Um, we've also done a survey with staff. So we've had 20 of the staff. It's much harder to get staff, unfortunately, to fill in these types of surveys, but we wanted to understand from the staff, the handling perspective, the people that are actually moving and tying down these devices, what do they see as the challenges when they have to tie down these devices and get them ready for air travel? And they've highlighted things like lack of hands-on training, challenges with communication, time constraints, improper securement. They've seen other staff or when an aircraft arrives and they're in charge of unloading it, they find the wheelchair was not secured properly when they're unloading it. So these are all issues that we suspected were a problem, but they're underscoring our hypotheses there. Um, the last thing we have been doing is trying to bring together the community around all of the key knowledge users that have a stake in this work for what we call the Air Travel Forum. This was done in September 2025. We had about 130 people between in-person and virtual. The morning was broadly talking about barriers to air travel accessibility. The afternoon focused specifically on preventing damage to mobility devices. We had a whole bunch of group organizations. I think we were very happy to see the number of airlines and airports and aircraft manufacturers that wanted to be part of this to keep this conversation going, despite um, the concern that they might look bad in being part of these conversations and the potential for um, of negative kind of a negative look on the part of them. But I think we were able to show these companies that coming and being part of this would demonstrate that they were a leader in the field and they want to find solutions. So we're happy with that, and we're planning for another conference in 2027 when we hopefully grow the group of people that are going to join us. So that's a snapshot of our project. I'm happy to discuss further a little bit later. Yeah, there's my information if anyone wants to call or email or learn more at our website. Thank you.
Great, thank you, Tilak. And I posted your a link to the journal article as well if people are interested in looking a little more on the academic side. As a reminder, we're going to have a Q&A session after Ali's presentation. So please post your questions for Tilak or Ali in the Q&A box. And you can find that Q&A box on the Zoom toolbar. Sometimes it's under the More button with 3 dots if you need to search around a little bit sometimes. So there you can post a question, you can leave a comment on a question or upvote any questions you would like to hear asked. So we'll answer your questions during that final Q&A. Okay, great. Thank you so much, Tilak. We'll move on to Ali's presentation now. So Ali Shirelli is a PhD candidate in population health and a member of the Life Research Institute at the University of Ottawa. She holds a Master of Science in Aging and Health from Queen's University. Her doctoral research explores the air travel experiences of people living with dementia and their travel companions to inform practical recommendations that support quality of life and shift the focus from care to life. She is committed to fostering age and dementia inclusive communities and advocating for the needs of older adults. That's excellent. We're thrilled to have you here, Ali. Please take it away by sharing your presentation. Looks great.
Thank you. It's perfect. Thank you for the introduction, Allison. Just bear with me here for a second. There we go. And thank you for being here today, everybody. I'm really excited to share some of the work we've been doing. Today, I'm sharing work that sits at the intersection of aging, dementia, and air travel, which is a system that I think a lot of us take for granted. I'll be drawing on two bodies of research, a scoping review that's in progress about what the evidence tells us, and then a qualitative study funded by the National Research Council of Canada, where we spoke directly with people living with dementia and their travel companions about their air travel experiences. And so today, my goal is to really connect the literature with what people actually experience. And so before I get started, I want to acknowledge the team. This is truly an interdisciplinary effort. Dr. Garcia and Dr. Robitaille are my doctoral supervisors in health sciences, and Dr. Mulvey and Valentina are at the Telfer School of Management. And so the topic genuinely requires multiple disciplinary perspectives to understand it. And I should also mention that what I'm sharing today is one piece of a larger research program. We make up the Daring to Travel research group, and the team has been exploring this topic over several years and across multiple different phases. And then most importantly, I want to acknowledge the 23 participants who shared detailed, sometimes difficult accounts of their experiences. This work only exists because of them. And so, quickly to talk about why it matters, and I think the numbers on the screen really give the scale. By 2030, 1 in 6 people globally will be over the age of 60. And in Canada today, more than 770,000 people are living with dementia. So these aren't niche populations, and they really represent a growing share of the traveling public. And for many of them, air travel isn't discretionary. It connects people to family that they can only reach by plane, to healthcare, and to meaningful experiences and social participation. And the quote on the slide comes directly from one of our participants, a person living with dementia. If I didn't have the support network, I don't know how much travel I would do. And that's not a complaint about a bad experience, but it's more of a quiet statement about what travel actually requires for this population and what happens when support isn't there. And so that tension between the desire to travel and a system that doesn't fully support it is really what this research is trying to understand. So I'll start by going over what the evidence tells us. Our scoping review followed Joanna Briggs Institute methodology. We searched 7 databases and gray literature, and we ended up including 77 sources spanning 51 years. And so with 77 sources, we had a tremendous amount of information to learn from. And today I really want to highlight some of the key findings, which are organized into 3 categories. One thing worth flagging about the shape of the evidence is that 55 sources were non-empirical, meaning that they weren't necessarily always peer-reviewed literature. And dementia-specific work really only starts to grow after 2015. So we're really still mapping a developing field. And I think that context matters with how we interpret what we know and where the gaps are. So the first category focused on how older adults and people living with dementia prepare for and can physically tolerate air travel. And the evidence consistently described air travel as a process where demands accumulate across multiple stages during the journey. Physiological concerns, including fatigue, dehydration, hypoxia, and thromboembolic risk, were well documented. And for people living with dementia, the picture is more complex. The in-flight environment, like low oxygen levels, noise, and cabin pressure, may amplify cognitive symptoms, and case reports in the evidence document post-flight confusion and acute delirium in older adults with pre-existing cognitive vulnerability. And for people living with dementia specifically, fitness to fly really extended beyond just physiological stability to include agitation risk and behavioral vulnerability. And importantly, the evidence did emphasize that age alone is not the issue. It's more about functional capacity, health status, and cognitive vulnerability that shape those experiences. And what older travelers, particularly people living with dementia, consistently relied on were adaptive strategies. So that could be simplifying itineraries, traveling with companions, and extensive pre-planning. And so the key finding here is that accessibility frequently depended on individual effort and informal support rather than consistent system level accommodation. So, our second category highlighted how accessibility is not only physical, it's also dependent on communication and coordinated service delivery. Across decades of evidence, responsibility for accessibility was described as fragmented between airlines, airports, security agencies, and ground handlers. And that fragmentation has documented consequences for travelers. Older adults in existing evidence reported inconsistent support depending on the airport, the staff member, or even the stage of travel. And communication barriers were also significant. Things like unclear announcements and rushed security procedures and inconsistent information delivery were documented across multiple stages of the air travel journey. For people living with dementia, these staff and communication gaps carried more significance. Unpredictable announcements and procedural complexity across airport stages were described as sources of difficulty and disorientation for travelers and their companions. Several sources also identified multimodal communication. So that would be combining visual, verbal, and simplified messaging as a promising facilitator. And dementia awareness initiatives and tools like the Hidden Disability Sunflower Lanyard are emerging, which is great, but implementation remains inconsistent and largely voluntary, which is not great. So you might not be able to, it might not be recognized depending on where you're traveling and what airport you're in. And interestingly, the review found no empirical studies directly evaluating whether coordination interventions or training programs improve outcomes. And the problems are beginning to be well documented, but the evidence on what fixes them is largely absent. The final category focused on how airport environments shape mobility, orientation, and safety across the full journey from terminal to cabin. And so walking, waiting, and wayfinding were identified as three core challenges. And additional barriers like glare, visual complexity, unclear signage, and limited seating have also been documented for decades. Security screening emerged as one of the most stressful stages, particularly for people living with dementia, because of the noise, crowds, rapid instructions, and procedural unpredictability all compounding at one point in the journey. And digital systems like kiosks and wayfinding apps can present an additional layer of difficulty for older travelers if they're not designed inclusively. But on the facilitator side, and they kind of mirror the barriers, simplified signage, consistent iconography, predictable layouts, reduced sensory stimulation, and quiet spaces were all identified as meaningful improvements in the airport setting. And the overall pattern across this category is this persistent gap between what inclusive design aspires to and what airports actually deliver, with cognitive, sensory, and relational accessibility consistently receiving less attention than physical access. And so that brings us to the journey through people's eyes. And so we conducted 20 interviews with 23 participants, seven people living with dementia, and 16 travel companions. Participants were living with varied types of dementia, including Alzheimer's disease, frontotemporal, Lewy body, and posterior cortical atrophy, and they range from the early to late stages. Participants traveled for all kinds of reasons: leisure, family visits, medical appointments, work, and advocacy. And interestingly, several participants had reduced their leisure travel, but were continuing to travel for advocacy purposes. And so I think that really represents that withdrawal from air travel isn't always a complete or voluntary decision, but for some, it's this gradual renegotiation of what's still worth attempting. And so over the next few slides, I've intentionally centered participant voices as these perspectives are exactly where our preliminary findings emerged from. And so a key finding across our interviews was that air travel was not experienced as isolated events, but as an ongoing emotional trajectory, one that begins well before departure and accumulates at every stage of the journey. And so, participant 20, she's a travel companion, and their quote really captures something that distinguished companion experiences in our data, the absence of any real reprieve. The companion holds the full arc of the journey in a way that the travel experience doesn't always account for. You're on all the time. There's no vacation from dementia. That alertness, it doesn't pause at the gate or on the plane or even when they land at their destination. It's kind of this ongoing feeling. And for both people living with dementia and their travel companions, distress had a distinct quality. It kind of built gradually without an obvious single trigger. And so participant 3 described how it accumulated on arrival. It did not start until I got to the airport and saw the crowd. Slowly, it's building up until you're sitting down waiting for the airplane. So the environment itself was the stressor in this instance. And then participant 22 speaks to something that came up repeatedly across several interviews. And it's a sense that the airport strips away control in a way that few other environments do. You're vulnerable, everything is out of your control in the airport. And I'm sure many of us can relate to that feeling. And so these findings really point to emotional safety as a dimension of accessible air travel that current frameworks don't yet address. And so our findings identify several conditions under which stress escalated. Participant 9 captures this in the terminal. A routine washroom visit became a prolonged separation. I waited and waited. I couldn't find him. We were panicked for 20 minutes. Navigation was a consistent vulnerability in our data, particularly when staff support was variable and when there was nothing in the environment to help reorient or reconnect. And participant 3 shows where that same absence of recovery can lead by the end of the journey. In my last trip, I might have had a panic attack and I collapsed in the airplane. I thought I was going to have a heart attack. And so this is an extreme case, but it really illustrates what the cumulative load of the journey can produce when there's no system of recognition in place. And participant 8 speaks to what we've called the shared emotional experience of the traveling unit. He picks it up like a sponge. So distress circulated between the person living with dementia and their companion in both directions. And travel companions often worked hard to manage or conceal their own distress to avoid affecting their loved ones. But of course, that's not always possible. And participant 22 points to a more everyday but equally disorienting moment at security. They're yelling, "Is this your bag?" Well, I can't see it, right? And so participant 22 lives with posterior cortical atrophy, a form of dementia whose primary symptoms are visual and spatial rather than memory based. And so their experience is a reminder that dementia doesn't present uniformly, and if accessibility frameworks are built around a single profile, they're kind of missing other needs that people have. And so here the cognitive and sensory dimensions compound each other in a way that the system just simply isn't designed to acknowledge or see. But on the other side of things, our findings were equally clear that distress was not inevitable and that small things could shift the trajectory of an entire journey. And so, participant 22 describes the Sunflower Lanyard program as a practical support, and participants described it as a way to signal support needs without repeatedly redisclosing at every touch point. Though its effectiveness depended heavily on staff awareness and understanding of the program. So, as I mentioned before, if the airport doesn't offer the Sunflower Lanyard program, then you might not receive the same support that you're looking for if you have that lanyard on. And then participant four offers something a little bit different, self-disclosure as an active coping strategy. Well, first of all, I'm not afraid to tell someone I have dementia. I've done that many times. And this is a considered, a deliberate choice to manage the journey on their own terms. And keeping in mind that not all people living with dementia feel able or willing to do that, which is precisely why systemic supports can't rely on individual initiative alone. And participant eight points to something concrete for training. If the care partner tells you something, they're the expert in that person. Care partners hold highly contextual knowledge that the staff simply don't have access to. Knowledge about routines, triggers, communication, and reassurance. And when staff recognized and worked with that expertise, participants described noticeably different experiences and outcomes. And finally, participant 23 recalled, he knelt down beside me, said to me, "Is there any way I can help?" Notably, this was actually a fellow passenger and not a staff member. And across our data, the service ecosystem was often held together by this informal support rather than structural design. And the fact that this moment stood out as remarkable says something about how rare it felt. And so, taken together, these moments point toward what a more accessible system could look like. And so, bringing together both bodies of evidence, the findings point toward potential pathways to inclusion across design, training, and policy. For design, the findings point to the need for improved signage, wayfinding, and predictability, particularly at moments where the environment shifts unexpectedly. So, those major touch points like security screening or boarding. And quiet and sensory reduced spaces came up across both studies as meaningful, and participants consistently framed these as improvements that would benefit all travelers and not just people living with dementia. And then the third point, designing for invisible disabilities and cumulative emotional burden, is really a framing that ties the other 2 points together. And ultimately, it's just that physical access alone isn't enough if the cognitive and emotional dimensions of the journey aren't accounted for. And then for training, empathy and communication styles shaped emotional experiences as much as procedural competence. Staff needed to move beyond procedural training toward genuine dementia awareness and the ability to recognize and respond to invisible disabilities, as difficult as that may be. And then additionally, recognizing care partners as part of the traveling unit is probably one of the most actionable things that could change in practice. It's not treating the person living with dementia and the travel companion as two separate passengers. They really work as a team. And then for policy, the system currently responds to discrete incidents rather than the accumulated experience that this research describes. And so expanding recognition of hidden disability programs and shifting from reactive complaint-driven programs, compliance, sorry, towards proactive co-designed accessibility standards are directions that both studies point toward. And so, where does that leave us? So, for researchers, we're starting to document the barriers well, but what we lack is evidence on what actually fixes them. So, evaluating interventions, longitudinal outcomes, and co design approaches that position older adults or people living with dementia and their companions as genuine research partners. And this is a vast and largely unmapped research space. We're really only beginning to understand the emotional, cognitive, and relational dimensions of these experiences. And there's an enormous amount of work still to do across design, training, policy, and service delivery. For people with lived experience, the strategies that were described by participants, like simplified itineraries, disclosure decisions, routines, knowing which airports work and which don't, that represents knowledge that the system doesn't formally hold. And so that knowledge belongs in service design and in staff training and in regulatory consultations. And so continued engagement from the community is not supplementary to this work. I really think it is the work. And then for industry and the general public, the International Air Transport Association's own 2025 guidance acknowledges that Regulations remain jurisdictionally fragmented and complaint driven rather than establishing accessible air transport in a coordinated way. And so both studies reinforce that the sunflower lanyard worked where staff had been trained to recognize it. It meant nothing where they hadn't. What worked in one airport might be unavailable or unrecognized in another. Assistance handoffs broke down between airlines, airports, and security. And so the infrastructure for inclusion exists in pieces, but what's missing is the coordination and commitment to make it consistent across the board. And then for anyone who's not in a formal role, a fellow passenger perhaps, I think a single attentive interaction can redirect an entire journey. And so the goal is a system where that should be the default and not the exception. And then these three quotes I felt share something. None of these participants are waiting for the system to catch up to them. They've found ways to make travel work on their own terms. Participant 22 is refusing to quit. Participant 4 has built a routine that carries them through. Participant 14 has found something freeing in what others would frame only as loss. And that's agency. And I think it's worth naming just because it's easy to frame this population purely around what the system fails to provide. And these participants remind us that the will to travel is there, but the work is building a system that meets them where they are. And so thank you for your time and for listening. My contact information is on the screen. So if you're interested in learning more or participating in future research, please get in touch. And then the QR code on the screen links to our Daring to Travel Research Group website. So if you're interested in learning about some of the other work we've done, you can scan that QR code and learn a little bit more. Thank you.
Thanks so much, Ali. If you wouldn't mind, could you also put that link in the chat for folks if they weren't able to get to it in time? I know that can be a
Yeah, absolutely.
stressful for people. Yeah, getting their phone out. I know. Oh, great. So we have lots of questions in the Q&A box. Tilak, I'll ask you to turn on your video so you can join us for this final Q&A. Thanks very much for these two great presentations. A lot of things are resonating with our audience, a lot of positive comments in the chat. So right off the bat, you've hit people with this, similarity of lived experience, regardless of where we are in our lives. So let's start with our first question. So upvoted to the top. How can mobility users find information about their rights as airline travelers? Who would like to take this first?
Yeah, sure, I can start with that. The rights, it's I think everyone, I think, if this went to court, it would be, I think, ultimately it comes down to everyone has the right to fly, and there have been a number of court cases where there air airlines have been there was a law that was passed to say that airlines had to provide an aircraft that would fit a given type of wheelchair. Like if there's a passenger that wants to fly with a given type of wheelchair, that they would have to provide that type of wheelchair given the airline is big, if the airline is a large enough carrier. That law was struck down in through the courts. And so, this is all of this remains in flux. What are truly what can people expect? It is a tricky time to get through all this. I think what our team is trying to do is to say, we know that, the next generation of aircraft, people are talking about getting wheelchairs on board aircraft. We know that's the ultimate solution, so that you can bring you can stay in your wheelchair if you're a wheelchair user, you can fly in your own chair. That is probably a decade away, but there's a lot of people talking about it. There are prototype kind of designs for how that could all work. Um, Ultimately we'll get there. In the meantime, unfortunately, I think we have this patchwork of other solutions that we have to work with, which might require people to fly to major centers to take larger aircraft that fit larger wheelchairs. And some people, I don't know that there's an easy solution around some of those things.
Yeah, and there's nothing like a compensation or subsidy program for people that have to, reorganize their travel plans to make that work. Yeah. Um, okay, so sorry we don't have a solution for that one, Olive. Next question. So I think Tilak, you mentioned this during your presentation, but maybe you can remind people that we'd like to know what is the data on how many damage claims have been made to airlines in Canada,
Yeah.
and how would you? What's the plan? What's the plan for KITE? You're doing some really great things.
Yeah.
So you're presenting these solutions, but how do we get this implementation? How long
Yeah.
is this going to take? Like how
Ex
is this happening in the real world?
Excellent question. Yeah. So damage claims, I don't know the numbers off the top of my head right now, but two-thirds of people we surveyed out of the kind of 500-ish people that flew with wheelchairs said they had damage. The huge numbers. The numbers would be huge for in terms of damage claims. Um, the yeah, in terms of what are we going to do, how are we going to make an impact in this area? So the results of this work, we've been told by Accessibility Standards Canada, our funder, that they are going to create a standard that will essentially take our recommendations and create a standard that will then airlines in Canada will be required to follow. So that's why I think we're getting, so I hope so the project has another year and a half or so. If we give us another 6 months to write a standard, a group of volunteers will probably need another year or so to take that draft standard that we create, that they then the volunteer technical committee will then have to finalize and get past. Yeah, in that around that time, let's say 4 to 5 years from now, we may have it. Unfortunately, it still will probably be 3 to 4 or 4 to 5 years. We'll have we'll have some kind of standard in place that defines how wheelchairs should be handled. The bigger but faster, what I hope will happen as a result of this project, that's kind of the goal that ASC has, Accessibility Standards Canada has. Our goal, though, I think one of the most impactful things we did was bring together these airlines and aircraft manufacturers with people with disabilities, with lived experience, sharing their personal experiences, how it impacted them. We had high level people come to our conference, and we're hoping to get more of those people to come. It's something that I think there's something moving in this space. People are paying attention. They're working to try to solve the problems because they're facing, like, some of these airlines are facing a lot of bad publicity. They're seeing that the media is picking up on these stories. So I think that's where the changes will actually come from. And our hope is through these conferences we can speed that all up by sharing. For example, the like Ali mentioned, the sunflower program. That was one of the programs that was mentioned at our conference too, and Air Canada had put it in place in Toronto, and it's a huge success. Our goal at talking about that at our conference was hopefully other airlines and other airports around the world will pick up on that and just implement it because it works really well. Hopefully we can do similar things with some of these other issues related to preventing damage to wheelchairs.
Yeah, and all the jurisdictional puzzle pieces are, it's very difficult for everything to fit together. And Jim, I'll just mention, since you brought up the sunflower lanyard, Jim Mann mentioned that has worked really well for him in the chat. And he's a older adult living with dementia, researcher and dementia advocate. So yeah, he supports that decision. There are a couple questions here, Ali, about travel companions. Could you share a little bit more about that? Perhaps the role, experiences of a travel companion, as well as travel companions maybe that are assigned at the airport. Yeah.
Yeah, so when I use the word travel companion, it's really just anyone who travels with someone who's living with dementia. So you can define that kind of however you want, whether that's a family member, a friend. It could be someone you might hire to bring along. Like I know we talked to a few travel companions who were care partners of people living with dementia who traveled. And they actually like hired a nurse or a PSW as a third party to join them on their trips as well. So travel companions can kind of be however you wanted to define it yourself. And then the role of a travel companion, they tend to like take on a lot of the planning and the prep for the travel is what we've learned from our participants anyways. But there are resources at the airport, like you can do an escort service. It kind of has a different name at every airport. Like we really need some sort of standardization so that people know what they're supposed to be looking for when they're traveling. And sometimes it's provided at the airport, sometimes through the airline. And so this is where someone will actually meet you at check-in, whether you need a wheelchair or just someone to take you through the airport. And so that is a resource that you can use at the airport if you're looking for a travel companion, or if you're traveling alone and you don't have anyone to travel with you, that's a good resource as well.
Great. But again, nothing is standardized, regulated.
Yeah, it's really confusing. We like prior to this project, we did a website analysis of 30 Canadian airports. And although many of them offer similar programs and services, they all have different names. Some of them are available at one airport, but not another. And so I can see how it'd be so confusing for a traveler, like when you're looking for that information. And then if you're flying from Calgary and you're flying to Portugal, you don't know what they're going to have available there either. So it's just this huge ecosystem, and there needs to be something. But as Tilak said, it'll take years for us to really kind of solve these problems. So it's good to start small and work your way.
The good news, I think, is though, like you mentioned, IATA, the international, I forget what it stands for exactly, but the
Air
International Air
Transport
Travel.
Association.
There you go.
Yeah.
Thank you. They are committed to to making it work better. I think they
Yeah,
also are under a lot of pressure. So I think that's a good sign too.
absolutely. It's on their radar, which is good.
Great. Yeah. Okay. So a few more questions. Some of them are related to the role of Canada, specifically asking, is this a global issue? Are you hearing things from other jurisdictions and how they're dealing with wheelchair accessibility, scooter accessibility, as well as for people living with dementia or other cognitive concerns. So what's kind of the difference here, or if there is, between Canada and kind of the global landscape? And is there a good model, perhaps, taking place in another jurisdiction that we could look to?
I can start on the wheelchair side of it. I know that under the Biden administration in the US, they made that huge leap. Pete Buttigieg was the transportation, I forget what their term is there, like Minister of Transportation, we would call it in Canada, but whatever their equivalent is. And he was the one that pushed for starting to think about allowing wheelchairs to come into the cabin, the passenger cabin, what that would take. And they started this thing called they call a rulemaking thing through Congress. And so the first steps of that started, and unfortunately, with the current administration, that's all been shut down. So I think I haven't heard much else happening kind of globally. I'm sure there are things happening globally, but the US was leading in this. Unfortunately, that's paused. I think with accessibility standards, Canada, there is all of a sudden a lot of work happening in Canada because they've been providing a lot of research funding for these topics. And because air travel accessibility is such a hot topic, I think I would say Canada is probably a leader in this right now.
Interesting. Okay, Ali.
Yeah, and I think just an initial thought is that air travel isn't like naturally a global problem, like a global thing, just because typically you're traveling globally, internationally, things like that. And there's many in terms of people living with dementia and older adults. There's a few research groups globally that are working on this topic, so that's really promising. There's a group in the United States, there's a group in Australia, and there's also a group in the UK. And I'd say the UK is probably ahead in terms of like regulations regarding hidden disabilities. So they actually have that put into some of their accessibility plans and things like that. And so it is being acknowledged. I think there's still lots of work to do, but there are best practices. Like when we were talking to participants, there's certain airports that do it better than others. And so I think it's important for other airports to kind of take what's working and use it at their own facilities. And so there is work underway, and we're getting there.
That's great. Undeterred. Yes, as we move forward. It's great to hear that from both of your presentations, the things you're doing to kind of lay the groundwork and move this forward within Canada. And I'm sure that will have a global influence as well. So thank you so much for both of your presentations. We've unfortunately come to the end of this session today. I'd like to thank you both for your presentations, for the participants, for your questions. We tried to get as many as possible. Be sure to check out our conference website for links to the recorded sessions and to see our EPIC conference program. You can see all the details of the sessions. Hopefully you will be attending those next week. They're taking place from Monday to Thursday. And the session on Monday is on mobility and transportation. So nothing airline related, but still mobility and transportation. Hopefully you can join us there. And we look forward to seeing you next week. Thanks so much, everyone. Have a great day.
Thanks,
Thank
everybody.
you.
Bye.